Good afternoon, everyone. This is Sandy Jones speaking from Parkinson, Canada, and this is our June lunchtime chat. Today, I'm going to be talking about advanced Parkinson's disease. I realize that this is not a topic that many people even like to contemplate, let alone think about or listen to a talk about, but at the same time, I think I would be doing you a disservice if I didn't talk about this in the eventuality that those of you who are even newly diagnosed or somewhere along the spectrum of the journey with their Parkinson's, that you may indeed get at some point, someday, some year in the future to having advanced Parkinson's, and maybe some of the coping strategies that you can use to get around this. So the key to living with any chronic progressive illness is taking responsibility to maintain your life beyond that condition. The condition should not define you or define who you are. One of the most frequently asked questions we receive here is, how fast will my Parkinson's progress? How do I know what stage I'm in? Some chronic or long-lasting and progressive or advancing and worsening conditions have quite clear-cut divisions between stages. Stages meaning obvious and predictable changes in the patient's condition. However, Parkinson's isn't one of those. It affects each person differently. Generally speaking, the progression takes years, and with proper treatment and management of new symptoms as they arise, people with Parkinson's can live independently for many years before they need to rely on others for assistance with their activities of daily living, such as bathing, dressing, toileting, etc. It is impossible to predict how any individual
has joined the conference.
Progress. And yet, this is a question that is on everyone's mind. What will I be like in 5 years? When will I need a wheelchair? When do I need to start looking for a nursing home? In my tenure here, over the past 19 years, I have seen some individuals advance to significant disability when they have had Parkinson's for 10 years. And I've also known others who have had Parkinson's for over 20 years and have not reached that more advanced stage yet.
Has joined the conference.
So some people eventually require 24/7 care in their own homes or in a nursing home? Yes, but it is impossible to predict whether that will happen for any specific individual. So don't let yourself or others try to project the future and predict the future for you. Prepare and plan for what may happen, yes. Project and predict or assume it will happen or within a certain timetable, absolutely not. Projecting and predicting only adds to your anxiety and may prevent you from taking some measures that can prolong the time between stages. Although your Parkinson's takes a path unique to you and you alone, there are some broad outlines of progression that I will go over now to ensure that we're all on the same page for this chat about advanced Parkinson's today. So, in early stage Parkinson's, when life can be fairly normal, the following conditions may occur. First of all, your symptoms are mild and are often easily explained. They can also often easily be missed by both you and your family doctor as well. Symptoms are annoying in the early stages and more of a nuisance than anything else, and they don't significantly interfere with normal activity. Symptoms occur on only one side of the body. If you have a tremor and it is present, it is usually in one hand or on one side and is usually noticeable when your hand or your leg is at rest. Other people may comment on changes related to your appearance, such as your lack of facial expression, your posture, your lack of arm swing, or the fact that you drag one foot when you walk. At this very early stage, your doctor may ask you, how much is your Parkinson's interfering with what you need to do or want to do? And if your answer is, it's not bothering me, it's just a darn nuisance, it's just annoying, then the doctor may suggest that you don't need to take any medication at this point. If, however, even though your symptoms are mild and they are interfering with your golf game, your fluidity on the ballroom dance floor, or your ability to be able to work, then medication may be prescribed, and the benefit is usually very effective in reducing and minimizing symptoms. In fact, I've heard many people with Parkinson's say that they don't even feel that they have Parkinson's, and others who say, wow, I haven't been able to move like this for a long time. That is what is commonly referred to as the honeymoon stage. Then slowly but surely, you will notice that your symptoms are gradually getting worse, and this is referred to as stage 2. So, in stage 2, you have stiffness, tremors, and your slowness of movement are more noticeable now, and they're prolonging your ability to be able to complete your tasks. Everything just takes a lot longer. Your balance should not be affected at this stage, but you may have more difficulty walking, and your posture may be stooped. The defining signal of progression to stage 2 usually is that people feel symptoms on both sides of their body, though one side may only be minimally affected at this stage. If you have a hand tremor, you might notice that it now affects your entire arm, making activities such as shaving, brushing your teeth, or combing your hair more difficult. Muscle stiffness may be responsible for increasing your neck, back, and limb pain. If you have been able to manage without medication until stage 2, now is the time you will need to rely on treatment, probably with our gold standard levodopa, to assist you with symptom management. Also, at this stage, the majority of individuals with Parkinson's can still live alone, though they may find that some of their tasks definitely take longer to complete. Once again, I want to emphasize that progression from one stage to another often takes years, and there's no way to predict anyone's individual progression. Stage 3 is the middle stage in Parkinson's and really marks a major turning point in the progression of the disease. Many of the symptoms are the same as those in stage 2, except now they're more severe, and the response to medication is also noticeably less effective. Your movements become slower overall, and rigidity or stiffness is now more problematic. You're more likely to experience loss of balance at this stage, and coupled with decreased reflexes are probably the reason that falls now become more common. The pull test that your doctor does as part of your examination, you know, the one where he or she stands behind you and pulls hard on your shoulders, causing you to take steps backwards or even to fall backwards. That is an assessment of both your balance and your reflexes. In stage 3, Things that you used to be able to take for granted, such as getting in and out of a chair, getting in and out of bed, rolling over in bed, are all more difficult now. You may continue to be independent with many things, even though, again, as I said, things definitely take longer. You also may require assistance with bathing, mainly for your own safety's sake. At least having some safety measures in the bathroom is also a good thing to have at this stage. Things like grab bars, even things like a bath seat or a bath bench. Doing buttons and zippers can be very impossible at this stage. Definitely annoying and definitely take a long time. The good news is that medication combined with occupational therapy, as I said, for things like grab bars and bath seat, even maybe a walker and other assistive devices, can help maintain an acceptable degree of independence. So far today, I've talked about early and moderate Parkinson's by referring to stages 1 and 2 and 3. From here on in, I'll be talking about what is referred to as advanced or late-stage Parkinson's. Those are stages 4 and 5. You will have noticed that up until now, I have used the word independence several times to describe the first 3 stages. Now, however, I will be referring to dependence, as it is the differences between independence and dependence that separates stages 3 from those with stage 4 and 5. In stage 4, it may be possible to stand without assistance, but movement such as walking usually requires a walker or another type of assistive device. Many people in stage 4 are unable to live alone because of significant decreases in movement and reaction times. Also, performing the tasks, again, of daily living, such as dressing, bathing, getting meals, are usually impossible and, if attempted, can be extremely dangerous. Stage 5 is the most advanced and debilitating stage. Extreme stiffness in the legs may make it impossible to stand or walk. People require wheelchairs and are often unable to stand without falling. Around-the-clock assistance is required as individuals are completely dependent on others in stage 5. Some individuals also experience side effects of medications even before stage 4 and 5, but it is very common for people to experience hallucinations in the late stages. Those are seeing things that aren't there. And often people also experience delusions. That's when you believe things that aren't true, when you have been presented with evidence that you believe is wrong. And sometimes side effects from the medications actually outweigh the benefits that people get in the latter stages of Parkinson's. Those with late-stage Parkinson's often develop both motor as well as non-motor complications, which dramatically impair their quality of life. These complications include motor fluctuations. You know those words, the on and off phenomenon, when you can move quite well at times, but then you're unable to perform normal activities at other times. These changes are sometimes gradual, but they can also occur suddenly. It feels like one minute you can do things, and the next minute you can't. Very disconcerting for many, many people. Other complications are things like dyskinesias. That's those uncontrollable body movements where you can't sit still or stand still no matter how hard you try. You may even have an unpredictable or even absent response to medications. Medications sometimes just don't seem to work very well. Sometimes they don't seem to work at all. You may have falls or problems with what I call the automatic nervous system, also known as the autonomic nervous system. You may experience symptoms of psychosis when you cannot distinguish between what is real and what is not. Sometimes people in latter stages also have depression, although in actual fact, depression can occur at any stage of Parkinson's. Sleep disorders are very common in later stages of Parkinson's, as well as symptoms of not only mild cognitive impairment, but actually dementia, when your ability to be able to perform tasks and do things is now totally beyond your control. At this stage, drug therapy should be driven by the attempt to create a balance between benefit and side effects of the medication. Both physio and occupational therapists, or therapy, I should say, as well as speech therapy, has an important role in all stages, of course, including the late stage of the disease, as there is never a time in life when a person with Parkinson's should hear from professionals that they are throwing up their hands and say, "I'm sorry, there's nothing more I can do." One question that comes up all the time, especially from clients who are newly diagnosed, is, when will I need a wheelchair? Or when should I put my name on the list for that nursing home? These are questions that no one has answers to, as some individuals require assistance within 8 to 10 years of diagnosis, while many people seem to have a relatively milder disease and remain stable for many years. With the advent of levodopa and other dopaminergic treatments, the progression of Parkinson's has become markedly slower than it was before 1970. However, over the years, treatment loses its efficacy. In other words, it loses its benefit. And that's the benefit that it's due to the progression and the progressive loss of the cells that produce dopamine, as well as the brain's inability to make the best use of both your naturally produced dopamine as well as the medication you take orally several times a day. So the bottom line is, the longer you have Parkinson's, the more difficult it is to treat, and the more difficult it is to know how much medication to give you. It's not that your doctors are keeping things a secret, it's just that it just becomes that much more difficult to predict how much medication you need versus what side effects are the medications going to have, and are the side effects more difficult to live with than the problems with movement, etc. So the truth of the matter is, while levodopa always works, your body's response to it and the predictability of its effectiveness does decrease over the years. Worsening of motor function and drug-induced motor complications, such as wearing off and dyskinesia, etc., those involuntary writhing movements, as well as what we call drug failure response, when patients don't respond to every administered dose of levodopa. These things all represent a major challenge for both the individuals in late-stage Parkinson's, but also for the doctors who are treating your conditions. I think the most troublesome and distressful complications are usually in the area of the non-motor symptoms, including psychiatric and cognitive problems, as well as the autonomic disorders and sleep disorders. Unfortunately, the symptoms I have just referred to are frequently neglected due to limited time during doctor's appointments, and also the perception of patients and caregivers that those symptoms are unrelated to Parkinson's, or don't have a sufficient awareness that their doctors have as well, and their doctors are usually focused on motor symptoms and don't think to ask about the psychiatric or psychotic symptoms, or don't think to ask about other non-motor symptoms. I think I have mentioned during every chat that, once again, this is why we encourage people living with Parkinson's to be referred to neurologists who specialize in Parkinson's. These neurologists are known as movement disorder specialists. Unfortunately, I realize that it does take a long time to get in to see these physicians, sometimes up to 2 years, but it is worth the wait, as these doctors have the most education and experience when it comes to dealing with Parkinson's, and at times even they are perplexed and find it very difficult to treat people in late-stage conditions. Psychosis and dementia are frequent in a significant portion of patients, and both pose as a risk for nursing home placement, unfortunately. Both of these conditions are also major issues of caregiver distress and can lead to caregiver burnout if they're not recognized and if coping strategies are not implemented sooner rather than later. You will read in the literature, and we always stress the fact that everyone with Parkinson's is different. Different symptoms, different rate of progression, different response to medications, including different side effects. This implies a careful assessment of whether the symptom is actually a side effect of the medication or is also related to the progression of the disease. In the more advanced forms of the disease, patients may also experience a greater sensitivity to even small changes in levodopa, or they become prone to adverse reactions to anti-Parkinson's drugs, as well as medications that are prescribed for non-motor symptoms. As recently as yesterday, I had the privilege of listening to a pharmacist who is a doctor of pharmacology and is very, very knowledgeable about treatment of Parkinson's disease, and in fact has written a book on medications for Parkinson's, which is available for you if you would be interested. Please don't hesitate to give us a call, as we would be happy to provide that for you as well as for your doctors, because it's written for both patients as well as healthcare professionals. And again, she stressed the fact that people with Parkinson's are often on so many different medications that unless a very well-educated pharmacist when it comes to Parkinson's or a movement disorder specialist sits down and carefully goes through all of the medications that you're taking, both for your Parkinson's as well as for other conditions that you may have at this time, that it is really hard to know who's on first. What medication is causing what symptoms? And could you do without some of the medications that you're currently taking? Just as an example, for example, this. Maybe you
joined the
have
conference.
high blood pressure, but some time ago, your doctor put you on a medication to lower your blood pressure. Okay, that was fine. But now you have Parkinson's. And the fact that Parkinson's disease, in and of itself, as well as some of the anti-Parkinson's medications, also reduce blood pressure. So now you've got three very important factors that sometimes get lost when it comes to dealing with your blood pressure. As a result, your blood pressure may be dropping to your boots at times. And when your blood pressure drops, so do you, i.e., it may induce you to have falls. So all of these things have to be taken into account when one has Parkinson's. As I've just mentioned, the incidence of falls is another major issue in advanced Parkinson's. It actually occurs, falls occur in approximately 40 to 80% of individuals, even when you're optimally medicated. Falls can occur because of a very unstable gait, a loss of your center of gravity because your posture may be poor and you may be leaning in a very forward position. You may have very poor balance at this stage. Your problems, as I've just mentioned, with drops in blood pressure, especially when you're changing position, i.e., you're going from a sitting to a standing position, or from a lying to a sitting position. And again, side effects of medications, such as antidepressants, etc. I mentioned about disturbances of posture, leaning too far forward, are also all causes of falls. Falls, of course, lead to fractures that further reduce your independence and increase your risk of possible admission into a long-term care facility. Also, patients who have fallen previously often develop a fear of falling, forcing them to become more isolated, more weak. And all of these things add to gradual deterioration and definite loss of quality of life. Although there is still insufficient evidence for effective prevention of falls, exercise interventions, especially in the early stages, that's stages 1, 2, and 3, have definitely shown to be effective at improving leg strength, balance, and walking. So never give up on your exercise or in visiting your physiotherapy or rehabilitation center. The bottom line is that medications do not help balance and do not help falls. So it really is up to you to do your own falls prevention by strengthening those muscles and as well as doing range of motion exercises and what I call postural control training. In other words, practice and sitting and standing up as straight as you possibly can. So while there are still many unknowns about Parkinson's, there are some things we do know, and I want to emphasize these things now. Keep in mind that not all of these things that you're listening to today are necessarily going to happen. But I think it's only fair that you are prepared, and as prepared as you possibly can be. So, as Parkinson's becomes more advanced, people generally have more difficulty functioning independently. But having said that, the cause of the disease varies, the course of the disease, I should say, varies considerably from each person. Also, many people with Parkinson's never reach the advanced stage, and instead they live a normal lifespan and continue to receive significant benefit from all of their anti-Parkinson's medications. Another thing that needs to be taken into account is the fact that different people react differently, both physically and emotionally, to Parkinson's. People have different levels of actual disability, and they also differ in how much a particular symptom may bother them. In other words, those individuals with a positive glass half full attitude will find ways of coping and will adapt and adjust to all the changes that Parkinson's forces people to face. Some people's bodies respond very well to certain medications, while others can't tolerate those same medications. And believe it or not, attitude can play a role in the effectiveness of medications too. The life expectancy of people living with Parkinson's is only a little shorter than that of people who do not have Parkinson's in the same age group. People don't die of Parkinson's, although some will definitely succumb to some of the secondary problems associated with Parkinson's, such as aspiration pneumonia or a complication of a fall. Putting Parkinson's aside for a moment, all adults who are competent and able to make decisions about their future health care should have a power of attorney for both health care as well as an advance directive for their health care, which tells your family as well as healthcare professionals what forms of medical care you would accept or refuse in a specific medical circumstance. In particular, if you become unable to make these decisions for yourself. Any adult can have an accident or suddenly become severely ill, and it is better for the individual, the families, and the doctors in charge of your care if these documents have been prepared ahead of time. So people who have been diagnosed with Parkinson's, as you can see, are no exception. Things can happen to anybody at any stage of their lives. So, in summation, there are a few more problem areas in advanced Parkinson's that I want to go over with you today. The first one is pain. Those of you who have had trouble with Parkinson's-related pain are likely to have more problems with it as the disease progresses. The three main causes of pain as the disease progresses are that muscles become more rigid, which can produce deep, vague, and nagging pain. Such pain is usually eliminated and adjusted and alleviated, I should say, with an adjustment to your medication. Pain can also be caused by changes in muscle tone, as it can result in muscle spasms, severe spasms that are known as dystonia. These spasms frequently affect the feet and sometimes the hands. Often these spasms occur as medication is wearing off, especially in the early morning hours. The most common solution is to ensure that the level of medication does not become low enough to allow these spasms. Sometimes taking a time-released medication at bedtime, such as a Cinemet-controlled release, or another dose of regular medication during the night can prevent these problems from happening. Occasionally, injections of Botox into the overactive muscle will weaken it and reduce the spasms and thus reduce the pain. And don't forget, you can't blame Parkinson's for everything. You can also have more ordinary things like arthritis, bursitis, tendinitis, or sciatica. Those things can all cause pain and not have any relation to your Parkinson's whatsoever. So you and your doctor need to establish which disorder is causing the problem and whether you need a pain reliever or an adjustment to your Parkinson's medications to ensure that you're not experiencing wearing off, as everything gets worse when that happens. I just want to spend a few minutes discussing speech. Speech problems are common in mild to moderate Parkinson's, and hopefully, if you're in one of those stages, you are actively pursuing the expertise of a speech-language pathologist. If by chance this is not something you're looking into, please give me a call, because if you're having a problem, I could provide you with contact information for the Ontario Speech-Language Association, which would help you to find a speech-language pathologist in your area in order to help you communicate effectively for as long as possible. In late-stage Parkinson's, communication may be significantly impaired. Voices often become softer, more slurred, hesitant, and sometimes excessively fast. Ultimately, others may have great difficulty understanding what you're saying, which leads to you being left out, becoming more isolated, as you can't be heard over the phone, or even you could be in the same room with family and friends, and they may ignore you and leave you out of conversations, even though you may have something very important to contribute to the conversation. If they can't hear you or understand you, they'll just ignore you. Speech impairment often vacillates during the day as your anti-Parkinson's medication cycles, and therefore, if it's working well, you become more able to speak, and those are times when you should be planning your social outings, your social activities, etc. If your speech is soft, sometimes a portable microphone can help you to be heard, but that won't help if you have significant slurred speech. Sometimes letter or word boards allow you to point to words that you can't say effectively. These boards can also help those who have difficulty retrieving the word that you want to say. That's that tip of the tongue problem. Computers can be programmed to produce a message on a screen, or messages can be spoken by the computer that have been programmed. So there are other ways in today's technology, including tablet devices and iPads, that can have a very important impact on your ability to be able to communicate. Whatever you do, do whatever it takes to communicate your thoughts and wishes. Otherwise, others, as well as strangers who don't know you, will make decisions for you, which is a very cruel and sad way to end your life. So in review, some of the problem areas in late-stage or advanced Parkinson's are cognitive decline, behavioral problems, psychiatric symptoms, communication issues, difficulty with bowel and bladder control, falls, impaired ability to do routine activities such as dressing, bathing, feeding yourself independently. You may have a less predictable response to anti-Parkinson's medications. You could have problems with swallowing, including drooling. You may have walking and balance problems and pain. Time does not permit me today to go into all of these issues in depth. But if you're having a problem coping with any issue, whether it's advanced issue or at any stage, regardless of what stage you are in, please don't hesitate to call either Robert or myself. Our numbers are 416-227-3372 or 416-227-3375, or if you're calling long distance, our 1-800 number is 565-3000, and Robert and I would be happy to try to help you to improve your quality of life. Thank you for listening today. I look forward to chatting with you again in August. And next month, we're going to have a talk. At the moment, just have to check and see what the talk will be about. Here it is. Physiotherapy and Parkinson's. Two very well-known physiotherapists, Jan Goldstein and Rebecca Gruber, are going to be doing a webinar for us on July the 11th. And these physiotherapists are extremely experienced in dealing with people living with Parkinson's. So please join us for Physiotherapy and Parkinson's on July the 11th from 12 to 1. I'll look forward to speaking with you in August. Take care, and bye for now.
The leader has turned lecture off and your lines have been unmuted.
Joan Scholdice
has joined the conference.
Hello? Hello?